Hello, today we're going to be talking about infertility. This is going to be the second video in our series. Today the subject is going to include in vitro fertilization, otherwise known as Artificial Reproductive Technology, or ART, and alternatives to assisted reproductive technology. Assisted reproductive technology, otherwise known as ART, involves procedures that handle a woman's egg and a man's sperm in order to help the infertile couple conceive a child. Now, this can also include issues specifically just with mom's egg. It can be dad's sperm, or it can be both. And this type of technology, there's different treatments that can help the couple get the egg and sperm together in order to create a new embryo. In vitro fertilization, otherwise known as IVF, means fertilization takes place outside of the body. IVF is the most effective artificial reproductive technology. It is often used when a woman's fallopian tubes are blocked, or when the father, few sperm, or the sperm are having trouble connecting with the egg. Now, this is a very expensive procedure. Typically, what they call a round will cost anywhere between $10,000 and $20,000, and it is not fully guaranteed that a baby will be conceived or delivered, but it is something that most couples, once they've been trying. 1. Ovulation induction. During IVF, a doctor will check a female patient's ovaries in order to make sure they are producing eggs. A fertility doctor will prescribe a hormone medication which will stimulate the ovaries to produce one or more. During IVF, they want to try to fertilize as many healthy eggs as possible. This is an expensive procedure, fertilize multiple eggs during one round. So this means they want to try to get as many healthy eggs out of mom's ovaries as possible. Step 2. Egg retrieval. During this stage of IVF, a female patient will receive a pain medication. The doctor will use a thin needle as part of a catheter to help retrieve one or more eggs from the female's ovaries. Once the egg is removed, it will be placed in a culture dish and then it will be transferred into an incubator. Step 3. Fertilization. In a lab, a technician will mix an egg with the sperm in a special chamber. Sometimes the sperm will be directly injected into the egg. The sperm and egg are then placed in an incubator and monitored for a couple days to see which ones develop the best. So for the next procedure, they're going to see which embryos develop to the best. Some will do better than others, and they can monitor this in the controlled setting of the fertility lab. Step 4. Embryo transfer and implantation. This step involves transferring a fertilized embryo back into a female patient. The doctor will select one or more of the healthiest embryos and place these in a small plastic tube known as a catheter and place the embryos back in the female patient. Now, they'll sometimes do anywhere between 2 and 4, but sometimes in the past they've done up to 6. And they want to see how many of these will take. So, with this transfer, this leads to the possibility of multiple births of twins, triplets, or even quadruplets. Because if you're putting one or more eggs in there, but let's say you put 2 or 3 in there, and those 3 eggs take, then you have 3 babies that are going to be born if they last the full term. So this has led to the increase in the amount of multiples that are born. Concerns with artificially conceived children. Artificially conceived children may be 2 to 4 times more likely to have certain kinds of birth defects. Recent research by the Center for Disease Control and Prevention show that ART babies are more inclined to have birth defects. These may include heart and digestive system problems, upper cleft issues, lips or palate. Research doesn't know why this happens. The birth defects may not be due to the technology. Other factors like age of the parent may be involved. The risk is relatively low, but parents should consider this when making a decision whether to use artificial reproductive technology. Now, if a couple decides not to use IVF, there are alternatives to ART. The first one is known as surrogacy. A surrogate is a woman who becomes pregnant using a male sperm and her own egg. So this would happen if the mother is unable to conceive and does not have any eggs to use for herself. So a surrogate will donate an egg. It'll be fertilized with the father's sperm, and then she'll carry the baby full term, and then once it's born, both parents will adopt it. The second option is known as a gestational carrier. The gestational carrier will become pregnant with a coupled egg and sperm. So mom will give her egg, dad will provide the sperm. They'll be fertilized. The carrier will then not be related to the baby. It'll carry the baby full term, and then once it's given birth, it'll become the parents. So those are the two options for couples that choose not to use art or artificial reproductive technology.